Mr. President.
Senator from Texas.
Mr. President, as all America knows, climbing health care costs continue to keep the American people up at night. A Kaiser Foundation poll in September found that the #1 health concern of the American people is prescription drug pricing. A whopping 70% of those polled think lowering prescription drug costs should be a top priority for Congress, making it the #1 item on our to-do list. But our friend and colleague from New York, the minority leader, objected last time I offered unanimous consent to take up and pass a bill, which I'll describe here momentarily. And I hope, given the intervening time and further reflection, he will not do so today, and we can get this bill passed and address this top priority of the American people. The good news is Republicans and Democrats both agree we need to do something about it. I have the honor of serving on both the Finance and Judiciary Committees, where we've been looking into this problem and some of the potential solutions. There are pharmaceutical CEOs who earn big bonuses as sales go up, and I'm not opposed to them receiving compensation, but pharmacy benefit managers who negotiate backdoor rebates that drive up out-of-pocket costs, that's a problem because of a lack of transparency. And what I find very seriously concerning as well is anti-competitive behavior when it comes to patents by drug manufacturers. There are two practices in particular the legislation I intend to offer a unanimous consent request on would address. One is called product hopping, which occurs when a company develops a reformulation of a product that's about to lose exclusivity. Let me just stop a moment and say one of the ways we protect the investment and the intellectual property of American innovators is to give them exclusivity over the right to sell and license that intellectual property, including drugs. That encourages people to make those investments, in turn benefits the American people and the world literally by creating new life-saving drugs, and that's a good thing. But there is a period of exclusivity, and after that expires, after that goes away, then it opens that particular formulation up to generic competition, meaning the price will almost certainly be much lower and more affordable by the American people. But this issue of product hopping is a real gamesmanship, as I will explain. First of all, before the drug loses exclusivity, the manufacturer pulls the drug off the market. This is done not because the new formula is more effective, but it will block generic competitors. The second issue is patent thickening, which occurs when an innovator uses multiple overlapping patents or patents with identical claims that make it nearly impossible for competitors to enter the market. This is nothing more and nothing less than abuse of our patent system, and it's coming at a high cost for patients who rely on affordable drugs. Earlier this year, I introduced a bill with our friend and colleague from Connecticut, Senator Blumenthal, who happens to be a Democrat, to address these anti-competitive behaviors. Our bill is called the Affordable Prescriptions for Patients Act, and it streamlines the litigation process by limiting the number of patents these companies can use in court. So companies are spending less time in the courtroom and hopefully more time innovating these new life-saving drugs, while opening up these drugs once they lose their exclusivity to generic competition and lower and more affordable prices for consumers. This legislation does not stifle innovation. It doesn't limit patients' rights, and it doesn't cost taxpayers a dime. In fact, the Congressional Budget Office estimates it would lower federal spending by more than $500 million over 10 years. And this is just savings to the federal government for Medicare and Medicaid. Undoubtedly, it would show significant savings for consumers with private health insurance as well. I'm sure it comes as no surprise then that this legislation passed unanimously out of the Judiciary Committee. Not a single senator opposed it. But that happened in June. This is December, and there's been no movement since then. We've tried to be patient because we know there are other bills coming from the Health, Education, Labor, and Pensions Committee. There's a bill coming out of the Finance Committee on which the presiding officer and I sit. And my hope would have been we would have been able to make progress on a larger package. But here we are at the end of the year, and there has been no movement, and we've been more than patient. But I think there comes a time when patience ceases to be a virtue, particularly when it comes to providing something that will benefit the American people. There's no concerns about the policies laid out in the bill, as you can see by some of the comments reflected in this chart. Again, my colleague, our colleague from the Democrat from Connecticut, Senator Blumenthal, said this bill offers a positive, solid steps toward ending abuses in the uses of patents. Senator Durbin, who's the Democratic whip, a member of leadership, says it's a bipartisan measure that passed the Senate Judiciary Committee. I not only voted for it, I co-sponsored it, and I believe it should pass and should become the law of the land. So imagine my surprise when the Democratic leader objected to a unanimous consent request to pass it a couple of weeks ago. He even went so far as to call this a manipulative charade and a little game, which is strange because he also called it a good bill. His biggest criticism was it didn't do enough. But as I pointed out then, if you sit around waiting for the big bill to get passed, nothing happens in the meantime, and it's the loss to the American people. So I think it's past time for us to take up this legislation and get it passed, get it signed by the President. Our friends in the House of Representatives have already passed 2 bills which put together essentially reflect the same policy. Well, I can't think of any other reason for the Democratic leader to object than pure politics. He doesn't want anybody to get a, quote, win. That goes for the senator from Iowa when she's offered a bill to reauthorize the Violence Against Women Act. She happens to be on the ballot in 2020 as well. And the only rationale I can possibly think of that the Democratic leader would continue to object to these bipartisan consensus bills is just he doesn't want somebody to be able to score a point on this side because he feels like that will disadvantage his candidates in the next election and advantage us. You know, there comes a time when we need to put those election considerations to the side and focus on making good policy. I happen to believe good policy is good politics. But the truth is, the Democratic leader, in objecting to the passage of this legislation, does have one very big and powerful cheerleader behind him, and that is the drug companies. The drug companies love it when bipartisan legislation gets blocked on the Senate floor, for whatever reason. The truth is they hate this bill and they don't want to see anything done on this issue. And inadvertently or not, the Democratic leader seems to be providing them a lot of cover right now. My constituents didn't send me to Washington to play these endless games. They sent me here to get results. And that's exactly what I aim to do. So, Mr. President, as I'd ask consent that as if in legislative session, the Senate proceed to the immediate consideration of calendar number 132, S. 1416. I ask unanimous consent that the committee report substitute be withdrawn and the Cornyn amendment at the desk be agreed to, and the bill as amended be considered read a third time and passed, and the motion to reconsider be considered made and laid upon the table.
Is there objection?
Reserving the right to object. I'll be brief because I've addressed this before. The senator from Texas, my good friend, is just engaged in a gimmick to cover up all that he hasn't done on making drug costs lower. 99% of what the public wants is not being allowed on the floor by his leadership when he was the whip, by this leadership, and now he wants to get well with a bill very small. Open up the floor to debate. We'll debate all the big things that will really reduce prices that people want, and we'll debate his bill. I object.
Objections heard.
Mr. President.
Senator from Texas.
Mr. President, I would point out to my friend from New York, I'm not the leader, the floor manager of legislation. That's up to Senator McConnell, the senator from Kentucky. And obviously because of the foot dragging on important things like appropriations bills, on the USMCA, the important trade agreement with Canada and Mexico, And now the impeachment mania that's consumed the House of Representatives, that's crowded out our ability to get other things done. Hence, my loss of patience after waiting since June to get this bill passed. So this isn't a case of me wanting to get well. This is a case of wanting to make the American people well by providing them access to low-cost, generic alternative drugs and preventing Big Pharma from engaging in the sort of gamesmanship that keep drug prices up and keep the American consumer down. Mr. President, I yield the floor, and I note the absence of a quorum.
Clerk will call the roll.